I had a lot of mentors during my residency that were fellowship trained, and seeing the caliber of their care was really fascinating. Just their efficiency, how thorough they were in what seemed as a new grad very limited amount of time with a patient at 45 minutes, and now I'm like, okay, we can do this, right? And so when I decided that I think this is something I want to pursue, I was looking across the board, a bunch of different programs, and I just felt Northwestern's was the best for me.
No pressure, but our next guest represents the future of orthopedic manual physical therapy. Does that put a lot of pressure on you, Rachel?
Oh, all the pressure.
All the pressure. A clinician who's passionate about the person as the pathology that she's treating. Well, welcome to the show.
Thanks for having me, Jimmy. I appreciate being here.
You're a PT and fellow in training from Wisconsin. Your work focuses on understanding how social and environmental factors influence recovery.
Correct, yeah.
How does it? Explain it to me.
Yeah, so I'm working in Wisconsin. My fellowship is through Northwestern. My clinical training site is then a bridge at Marquette. And through my time going to Marquette for my undergrad and PT school and then my residency at UNC, I've always been passionate about trying to find like social disparities of health and equity, access to things like food, quality medical care. Can they get to it? And in the community I work with now, it was a relatively under-screened portion of healthcare where most of my colleagues weren't asking patients, and I think we were just missing and not capturing a big component of health. So trying to make sure that my patients have access to it makes a huge difference, right? If they can't have access to things like food,
sort of a big
they're
deal.
never going to get better, right? Nutrition is such a huge player and role in healthcare that getting basic needs met is where I'm trying to start with my patients, and then from there we go and hammer in their goals of why they're actually seeing me.
Ballpark, how long has this been a focus of yours?
Probably since I was in college.
So I feel like right now in 2025, two of those things you just mentioned, food and healthcare, are being
really
talked about like
popular right now in November.
Day.
Yeah, very popular. I've had a lot more patients. We are using just like a standardized screening of in the past 6 months. Have you had concerns about where you're getting your next meal from, or access to transportation, access to housing, things like that? I definitely see a lot more patients when I'm at Marquette screening positive on this. I'm not currently full-time as a pro bono clinical instructor. I'm just filling in right now due to my fellowship hours. But in the past, having my patients ask these individuals that are coming who are underinsured or not insured at all, and making sure that they have access, because it's easy to ask a question and say, do you feel like you know where your next meal is coming from? But then it's how we're taking that to the next step of, okay, so you don't. Here's some resources. Let's get it for you. And I had some great mentors when I was at North Carolina too, where they actually started a mobile food pantry within our clinic, and we would give patients the immediate essentials of what they needed to at least get them through that day until we could get them access to better resources.
I don't think I've ever asked a patient that.
Yeah.
I don't know that we've ever had a conversation about that.
Right. And it's not a common thing. I think it's just something that when I was at Marquette, they really emphasized Jesuit values, care personalis, care for the whole person. And then I kind of just stole that from them and ran with it in practice.
So where and when is a good place to ask that in sort of the continuum of care? Is this only on evaluation? Is this all the time?
That's a really good question. I'm at my current clinic. We're asking everyone at their evaluation with a form, and on that form then it says if they're screening positive, do you want resources, right? Because we have to ask permission too. We can't just assume that they need them or they don't. I do have some patients that don't fill it out because they don't feel it's important or pertinent to their medical care. So then in our evaluation, I will just ask and say, hey, part of healthcare is making sure that you have your basic needs met. Do you have concerns about any of, these things? List them off. If they say yes, I say, okay, do you want any additional support for that? Sometimes they'll say no. Most of the times they're like, oh, what do you have?
Yeah.
But I don't necessarily do follow-ups, which I probably should, especially now with SNAP benefits being questionable.
Mm-hmm.
I probably should be following up more, but I typically just do it at their evaluation and then tell them okay, if anything changes, let me know.
What kind of resources do you put together? Is it a toolkit? Is it a...
Yeah, so I have, for food resources, I've got a bunch of different food banks. Ours websites, try to connect people with them. I have, for transportation, we have a bunch of different community groups that will transport people from Milwaukee to Waukesha County, or vice versa. I work primarily in Waukesha County, so within Waukesha County, and then we also have some like emergency housing resources, phone numbers, things like that. I luckily have not had to use any of the emergency housing resources, but I give out the food resources pretty frequently.
Okay. Well, I'm glad you're doing that.
Thanks.
Let's talk. You're a FOMPT scholarship recipient.
I am.
This is new.
Yes.
Like, I feel like this is the year it's being sort of talked about, right? Or the
Yeah. So I'm not really sure. I don't think it's new. I know it's been around for a bit. They had reached out to me to get interviewed, and I said sure. But yeah. So the FOMPT scholarship, what's really helpful about it is it takes a lot of the pressure off of where is your finances, like where are they coming from to pay for continuing education, and that was a huge decision, like in applying to programs. Northwestern's calipers, like it's unmatched. It's so great. I love the program, but it comes with a financial cost, right? And I would say it's relatively reasonable compared to other fellowship programs. But having the opportunity to apply for something that then helps further education is so appreciated. And I mean, it's allowing me to be here, which is awesome.
Yeah. Otherwise, what do you think it would look like? Would you be doing this? The work that you're doing now?
I think I'd still be doing it. I think it would just be potentially slower in terms of like other areas of, okay, how are we paying for this? How are we valuing it, right? Like my husband and I just got married, and like we were delaying a house, we're delaying other things to pursue this training, which is, I mean, I'm really doing it for my patients, so I think it's well worth it.
Yeah. Well, I'm glad you got the help from FOMPT.
Yeah,
we're going to talk
me too.
to.
It's great.
We're going to have a conversation with some of the people involved in putting that together and get deeper into that.
Yeah.
But I'm glad to talk to someone who's on the receiving end of it and see where it goes, because I think that's sometimes the story that maybe gets missed.
Right. Yeah, it's great. It's going straight towards my tuition, so I really appreciate it. Yeah.
You're designing clinic screenings now as well. So you're designing the screening.
So that's primarily what we've taken into my clinic, and I'd asked my boss, he was very receptive, like, yes, we should do this. So we started with our own draft, and then I started looking stuff up and just merging from other people's work. So it's really not like my own. It's just stealing from a bunch of different. Yeah, it's stealing from a bunch of different groups that I really like what they're doing.
Did you put the citation in there?
Yes.
So
Oh, yes. Yeah, true. That's true. It's at the bottom of the survey. So
that's what we mean by standing on the shoulders of giants. You put the citation on the bottom,
exactly.
And your work is on top.
Yeah.
But that's why they did that work.
Right.
Is so you could do this work.
Exactly.
And then you're going to be a citation one day.
Well, we'll see.
What are some of the biggest barriers that you see coming from patients facing outside the clinic that affect their outcomes inside it? We just mentioned food. We just mentioned access to even getting to a healthcare provider, or the finances that, if they lack the actual insurance coverage. What else?
I think another huge thing that I see with my patients is just time commitment and making sure that, they're seeing value in the care we're providing, which is what I think fellowship is really helping me hone in on, is how can I be more efficient to get you out of my clinic? You don't need me as much, right? I think any good PT, we're trying to close our doors, right? I want my patients out and not in with me, but time is definitely a barrier. I have a lot of parents that are working, full time, have multiple kids, trying to chase them around, exactly, and it's just, that's probably it's a huge challenge. So I'm like, what is one thing you can do that you're already kind of doing, but now can we just tailor it? Try to find something that works easy in their life.
You talk about things like we take for granted, which is these things in our pockets, right? Which like, well, everybody has access to the internet. Well, that's actually not true. Not everybody has reliable access to the internet.
Right.
So someone just said, well, we could do telehealth. Well, if you don't have reliable access to the internet, you don't have transportation to telehealth. If you don't have transportation to healthcare. So there's a lot of things that I think get really overlooked that I myself included have never I just assumed that this is the floor, when it is in fact not the floor.
Right. And I mean, when I moved back from North Carolina, I'm from Wisconsin, so when I started working in Brookfield, it tends to be a relatively affluent area, but I also have a lot of patients that are sourced from less affluent areas, and even within Brookfield itself, I think it's kind of like under the rug where everyone just assumes this is a relatively well-off area, and I just think if you're not looking for it, you're not going to find it, right? But it's there, which is, we have a good role to play to help change that.
Sure. For a clinician listening and saying, I don't do that either, talking about the screening, how could busy clinicians sort of realistically start addressing social factors without feeling overwhelmed or overstepping their scope? Like, do they have to go to their boss, or what would you recommend if someone was nodding along going, oh shoot, this is something I probably should be doing?
Yeah, I don't think you have to go to your boss, right? Like, I don't think you need, we have this questionnaire that I have put together is like 12 bullet points, right? Like, it's long. I'd like to make it shorter, but you could start as simple as asking your patients, like, hey, have you had any recent concerns in regards to access to housing, transportation, or food? If yes, okay, do you want any additional support? I think you have to be comfortable asking, right? Because it's a topic a lot of people don't want to talk about because it is uncomfortable.
Super uncomfortable.
And then you have to be ready, like before you ask the question, you have to know what would you do if someone says yes, right? And that's kind of where there was a delay. I've been at my current company for 2 years, and we just started this in the summer because I had to develop what would we give people, when they do screen positive. And I remember the first time, there's actually a colleague of mine that his patient screened positive, and he's like, what do I do? And I was like, here's our resources, right? Yeah. But if we had put this out and didn't have that, then it kind of looks like, okay, we care a little bit, but we don't know if we care enough to actually then give you the resources. Yeah. And it takes time and energy to do, but I think it's really important, especially if you are working in an area that has a higher population of an underserved community.
If you're still early in your career, like yourself, and you're still really, and you're already driving change, like you're doing that
Hopefully.
now. Yeah, it feels like it, sounds like it. What inspired you to take on something so big? A lot of times people, when they graduate, there's, I just want to keep my head above water. Just want to make sure I meet the minimum standard. Yeah. It feels like you're doing a little more. What sort of inspired that?
Yeah, so I had a lot of mentors during my residency that were fellowship trained, and seeing the caliber of their care was really fascinating, and just their efficiency, how thorough they were in, what seemed as a new grad, very limited amount of time with a patient at 45 minutes. And now I'm like, okay, we can do this, right? And then my husband went through it, Stephen Hegarty, he did Northwestern's fellowship. My boss, Trenton Raymond, did Northwestern's fellowship. And so when I decided that I think this is something I want to pursue, I was looking across the board, a bunch of different programs, and I just felt Northwestern's was the best for me. And how thorough the program is really why I'm doing it, right? You're not going to fall through the cracks. We're like a family of 7 of us right now, all going through it together, and just seeing how efficient I can be, how quickly I can get my patients better, but also I think giving it a higher standard of care is what's important.
If every PT listening right now, everybody listening, took one small step to improve health equity in their clinic, what would you want it to be? And it can only be one. Because you mentioned a lot.
Yeah. But
you only pick one. What's the lever you'd want them to pull on?
That's a great question.
Thanks.
I don't know if I have a great answer.
You can have just the answer. You don't have to think low. Like you can answer for you.
I think the simple answer is just ask candid questions and be authentic in asking them, right? And use those answers then to drive change if you are seeing a lot of positive responses that, perhaps surprise you.
Would you make this, can you make it public? Can we share this with people, the screen that you created? Is that allowed? Are we allowed to do that?
Granted, it's not something I created. I stole it, remember?
You borrowed it, and you cited your sources.
I
so
do.
It's okay. So we'll see if we can do that.
Yeah,
and put
I'd be
in the show
happy
notes
to pass
and just have people
it.
take a look at it.
Pass it along.
Perfect. Last thing we do on each episode is called the parting shot. Last chance for a mic drop moment or a soapbox statement. What's one idea maybe you'd want to leave with the audience around today's topic?
I would say continue to be genuinely curious about your patients and really get to know them as people. And I find most people are very thankful when you start asking them questions that are potentially more sensitive. Even if they are screening negative, I've had a ton of people that are like, oh, thanks for asking that. That's really nice that you asked, and it shows that you're a genuine person that cares more than just about what their injury is.
I'm sure it also makes them think about the other people in their community. Like
if
you're asking me and I don't need that, maybe other people actually do.
Right. Yeah, and just small steps are all it takes to make a difference in someone's life. So.
Rachel, thanks for doing what you do, and I appreciate you sharing here at Hands On, Hands Off.
I appreciate it. Thanks, Jimmy.
Thanks for listening to Hands On, Hands Off, the official podcast of AOMPT. Subscribe now so you never miss an episode, and connect with us at aompt.org or at AOMPT on social. Opinions are those of the guests and not official AOMPT policy. See you next time.